Hello, everyone. So, given this present situation, I've decided to make this video on using this simulator, the COVID-19 simulator. So, this has been very nicely developed by ISee systems, and they use a concept of simulation called system dynamic simulation, which uses some assumptions and guesses to build up on looking at what the future might look like. So we know that we are all being impacted by the COVID-19 spread globally, and it is a pandemic now. So the objective of this session was very simple. I wanted to show you how different policies, specifically distancing and few other policies, help in the spread, in stopping the spread of the disease or actually reducing the amount of casualties. And also, based on a very simple scenario, simple set of assumptions and scenarios, I wanted to show, what sort of decisions or what sort of new discoveries about the disease can actually change the way the future might look like at this point. So let's start directly. So we'll start with a very simple assumption of what happens if we don't do anything and we deny the existence of the virus, or even delay on taking actions. So if we start with the concept of do nothing, so first of all, let's actually discuss few of the basic assumptions and informations about COVID-19. So COVID-19 is a pandemic and it's affecting almost every region of the world. China has, and not only China, I would say South Korea has also have more or less effectively controlled the spread of the disease. Italy and Iran are hit really hard, and even US, things are looking shaky. The disease, we are still on the process of understanding many of the symptoms of the disease, many of the issues with the disease, and we are still looking for a vaccination. So we really need to do something about policies, but still no idea of how long it might take to have a properly commercialized vaccination all around the world. So this model is based on not specific countries or cities, but on a very hypothetical city. So we are looking at something called any town, a very hypothetical city, a city of 1 million people. Now, the idea is the simulation starts with a single infected individual enters the city at the beginning of the simulation. And the individual will keep on infecting people over time. So now, although this is based on a single infected individual, and this is just a simple model, you can imagine how things would change with multiple individuals getting in. Now, people will get sick. Now, we can take some actions to reduce contacts and the chances of disease. And also, we can play around with different situations of people getting tested, different rates at which people are getting tested, and also look at what if the nature of the disease changes over time. So first of all, we will look into how the disease assumptions look like and how they impact the overall outcome. So initially, the basic assumptions of the disease is like this, that normally it's 10% asymptomatic, 30% mild, which basically means that it would affect 30% of the people mildly, 40% people moderately, and 20% severely. And also there is this level of infectivity. So we are generally assuming 40% infectivity. I think we can actually increase this given our present context because the disease has been found to be quite infectious. So let's look at 80% infectivity. And also, if for a country where there is a lot of old people or not enough clear sanitation or not enough cleanliness and quite crowded, I would say the severity would be a little bit more as well. Maybe a little less on the mild. So we increase both moderate. So let's say 40% moderate. Let's make mild around 25%. Let's create moderate for 40% and around 25% in severe. So just based on these changes in assumption, we can see that on the daily levels of hospitalization and cases, but instead of looking at daily, it would be very interesting to look at the population status over time. So we could expect that, in the first 20, 25 days or 30 days, the increase is not much, but then there is a massive increase. And this takes a very high number, actually, like presumed new infections, too ill to work. And if we look at the cumulative measures, we would expect, like within a month or two, it shows the simulation that the cumulative deaths would go up to thousands. Then, based on different policies of containment and other assumptions, it might stable down, but we'll play around with them later as well. So let's see what happens if the behavior of the disease modifies a little bit. So the first behavior, we're talking about baseline contact. So the concept is very simple. The number of unique individuals that a person runs each day, average across entire population. So the initial assumption is that the first person who's infected runs into one person per day. Now, in a dense city, I would expect this to be much higher. So what happens if we double this? So doubling this, say coming to 2 approximately, increases the rate at which the deaths go up and reach their peak. And if you look at the population status, this is actually prohibitively high. Even the infection curve looks quite bad. The amount of death quite high here as well. So what happens? What about adjustments? So by adjustments, they mean the adjustment contacts that mildly symptomatic. So what if people individually cut their contacts? This happens if a behavior, like changes with behavior. So if the person who's infected, if he or she tries to self isolate himself or herself. So let's say she manages to isolate herself quite well, and we have, say, or actually in a dense situation, it might be hard to isolate yourself. So we can see this. At the same time, we can look into the adjustment of contacts of people, like 0.05 means contacts are cut to 20th of what they have. So in this case, say symptomatic adjustments for those who are actually having the symptoms. So if we change it to, say, 50%, that is, they manage to reduce their contacts by 50%. And for those who have tested, let's make it absolute 0. So in this case, the cumulative measures look like this, where we have cumulative testing requirement of 5K within 2 months almost. And if you look at the hospital beds requirement, on the other hand, cumulative deaths is around 35K still showing, like that's the maximum that could reach for the city. Now let's change the duration. So the first is infected, not contagious. How long does this happen? So normally it's said that it takes 14 days, but if you assume that the peak is around 7 days, now contagious but not symptomatic, so that is the riskier part of it, and let's say that's 7 days as well. And symptomatic and contagious by severity. So let's say they're moderately severe, so that becomes around 10 days. And symptomatic but no longer contagious, let's assume that to be approximately around, so this basically tells us that let this be around, say, they're not contagious, so maybe a very small amount of people, because if they are showing symptoms, then they are contagious. So let's make it 2 days only. So we can see that the cumulative deaths are still not that high, because this actually talks about, like, still has not increased that much. It's around 34K. But what we can see is this curve is still quite steep, and this one is actually quite scary, that it increases very quickly, which shows the exponential impact of this pandemic. Now, in terms of mortality, if we look at few factors, so for example, it says that for moderate, the mortality is almost nearly 0. So let's make it 0. But for severe, the mortality is 15. It's actually showing, the virus is actually showing much more. So say, let's make it 20%. Now, this would affect the total mortality. So yeah, cumulative deaths have actually now gone up to 45%. So just 5% increase in severity would actually lead to not five, actually 10,000 increase in deaths. So these are assumptions based on, what would it say, the the nature of the disease. But now let's look at, given this nature, let's actually go back to the default assumptions of the disease and still try to see what policies can help in controlling the disease or tackling the disease. So here we have few simple policy variables, and here we can see the infection curve. So given the basic set of variables, like a quarantine day, start day of 60, like, so on the 60th day you start the quarantine. From the first day the person is entering the system or entering the city, then let's say a quarantine duration of only 14 days and quarantine effectiveness, say, just 10%, which is reasonable in very like less educated countries, or where the population is quite rebellious. Or let's make it a little bit more positive. I believe that people would at this point listen. So say 50% of the people listening. And if, say, 0% contact tracing effectiveness, symptomatic test rate is around 0.1, which means 1 in 10, like in 10 days. 0.1 basically means that it's the reciprocal of it. So in 10 days you get tested. And the daily testing capacity of, say 1,000. So we can actually look at how the spread happens. So if we press the animation side of it and press go live, this will actually show us like how, after entering one person, how the disease spreads. So this basically showed how it would spread and how people would recover to reduce. What happens if the quarantine is taken at the right time? Suppose in a month's time, how does this change? So let's keep our striker to here and let's repeat this. As you can see, the spread is still high, and yet there is like a first slowdown, which basically means that the medical systems in the country would have some time to respond. Now, what if the quarantine duration is longer, say a month? How does this change? As you can see, it's quite concentrated initially. There would be a tipping point, but as you can see that the total deaths has not changed much, but the initial spread has actually slowed down initially. So that's one. And let's say if people are actually listening to quarantine, so let's say it's 75%, and then what happens to the spread? As you can see that it's quite good until a certain point where it won't be able to be like contained. But you can see the amount of time that the medical authorities or the state will get in order to prepare for this. Now, if we look at this is the animation of spread, but if we look at the graphs, let's see what happens. So if with a 30-day quarantine, this is quite an interesting graph that, the effect will come much later, and at the same time, the deaths would be much less. Even the population status looks quite interesting. What happens if people don't listen? What happens if people are not following the quarantine? Look at the graph. So the less the people are listening, it's shifting left, which means the peaks are going to happen quicker. And that's the problem. That's what people are talking about, like flattening the curve or reducing the peak, or even shifting the curve to the right, so that to give our health authorities some time. What happens if quarantine duration becomes less? Again, it's shifting to the left. Much worse is what happens if we start our quarantine much less, say in 2 months' time. Here. So if you play this, you can see that the increase is quite fast. And new infections rise a peak, and the death toll is around, so you can look at the cumulative deaths here, around 23.3K, where it's studies there. Now, if we look at, say, failure of, so what happens if we can track our corona victims? Effective tracking will shift, and not only shift, it actually helps in flattening. So the more effective the tracking is, it would help us flatten the infected rates and the death rates. What about symptomatic test? So if we can, so instead of 1 in 10 days, and 1 means in 1 day, so if we can manage to test, say, in 2 days, look at, like, even we don't need to go through it's 2 days. So if we go in, like, if you can manage 0.33, which basically means that we can test a symptomatic case in 3 days, look at the immense effect in reduction. And if you increase our testing capacity, things are really good. So for 100, it's quite bad, but if the more we increase, the flatter it gets. And the cumulative measures should be really good here. So the cumulative measures shows massive decrease, like around 5,000 decrease in cumulative deaths. So the purpose of this small video and the purpose of showing this simulation is, I know that this is based on a very simple set of assumptions, and these assumptions are quite generic, even the calculations are generic, but I wanted to show, first of all, the tipping point, the exponential rise of this death rates, as well as the spread. Specifically, if you can see the animation and how it happens, let me repeat that again here. As you can see that even being so effective, it doesn't spread initially, but then 1 or 2 cases, and then it piles on. It piles on very close, very fast. And this is a very efficient system here. So now, yeah, it shows around, yeah, it would pile on in a year quite fast. Now, that was one thing that, the virus would show a exponential relationship here. Besides that, I think it's very important is the policy sides of, so if we want to mark something really important here, it's this policy side of it, that the more effective the quarantine and the more we make it effective, that is, the quarantine effectiveness is actually based on us. So the more effective the quarantine, the more we can shift the curve to the right. And besides that, if we can also take that time to increase our testing capacity and our contact tracing, as well as testing efficiency, then things might not look as bad as as the simulations show, right? If we look at the graph here, with more or less good efforts, so this actually shows quite a encouraging graph at this point. So in summary, I'd like to say that 2 weeks is not a long time. We might want to have more than 2 weeks. Testing is actually one of the key outcomes or key policies that would affect the spread and the deaths of this virus. I think the key, one very worrying takeaway is the fact that it's even being contagious, we don't show symptoms. And better quarantine does not generate a preferable outcome if given the fact that testing is not worked on, and if people are not, quarantine is not effective, that is, people are not taking quarantine seriously. So that's all about this model. Now, I really want to stress the reason I'm uploading this video and sharing it with you is because it shows how simple model can give us an insight on what behaviors to take and what policies to focus on for the coming times. And I hope that the people who are looking at this video, the policymakers who are looking at this video, might be inspired to develop something like this, a model like this, which would help us predict what would happen to different policy changes regarding this pandemic, and not only just because of this pandemic, but also the economic crisis that is being predicted to come. And yeah, that's about it. Just trying to show the importance of a good simulation in times like this. Thank you so much for listening. That's all for now.